Are doing well, my dear friends. So the topic for today which we are going to discuss is your effect of yogic practices on musculoskeletal system. So what are the different effects of your all yogic practices, whether it is asana, meditation, pranayama or other practices? When we are doing any practice, right? So when we are doing any practice, what we need from that practice is the effects, the benefits which we have to take from that particular practice. So the effect of yogic practices on the musculoskeletal system that we are going to discuss today. So before to go to the effects and the benefits, we must have to be a little bit idea about your musculoskeletal system. As we have discussed in the earlier classes about the skeletal and the muscles, right? So skeletal system is basically divided into two parts that we call axial skeletal system and the appendicular skeletal system. In the axial skeletal system, the component that comes is your center part of the body. Which part? Center part of the body that constitutes to form the central part of the body. So the components that forms the axial skeletal system is your skull, spinal column, rib cage and sternum. Skull, spinal column, rib cage and the sternum. If we come to the appendicular one, that comes your limbs or extremities, right? That comes to the limbs or extremities. So shoulder girdle we have, then we have an elbow joint, forearm bones, wrist bones we have, then we have a metacarpals and phalanges. Then pelvis on the lower body, knee joint, ankle, metatarsals, tarsals and your phalanges too. So these are the structures, right? As we have already discussed in the earlier classes in the details, these are the structures that form the skeletal system. Muscles, there are n number of muscles in our body, more than 640. We have discussed the major group of muscles in the classes. So around with this structure, if we have one preview in our mind that this is muscle and this is skeleton, then only we can explain the benefits to our students, my dear friends. Because we must have to know first and foremost things what we are going to talk about. What we are going to talk about, which benefits, about which structure, I have to take that all those benefits. I have to clear about the structure first, where it is, how it functions. That comes under the anatomy and physiology, right? Where the structure is located and how does it function. So the structure, location and the functioning, that comes under your anatomy and physiology, and then only we can explain the benefits or the effects of yogic practices on musculoskeletal system. So if we come to the benefits, right? Benefits, if we come to the next slide, like what are the different benefits? If we come to the next slide, that the different benefits are there. So as we come to the next slide about the effects of yogic practices on musculoskeletal system. So introduction to the scientific study on yoga demonstrate. So many researches has been proved that the scientific study on yoga demonstrate that yoga improves dexterity, that is your skillfulness. Skillfulness means they work along together, right? They work along together, like it's any movement or any practice if I'm doing, right? So it's not only working on the muscle, it is also working on the skeletal system, right? It is also working on the skeletal system. It also works on the other structure which is inside your skeletal system, whether it is your tendons, ligaments and other deep connective tissues. It also strength. It increase your strength, improve strength also. Whatever the pose which we are doing, any pose which we are doing in our comfort zone, right? It's not we have to force the or push the student to hold it. If the breath is going out, come out of the pose, my dear friends, right? So strength it improves when we are going to hold the pose. So when we are holding the pose, it increases your muscular strength and it increases your bone mineral density also. The blood flows everywhere in your bony structures. Also, musculoskeletal coordination of the practitioners. When we talk about this musculoskeletal coordination of the practitioners, so it improves the musculoskeletal coordination of the practitioners. If you have seen some people who are not practicing yoga, right, and who have sedentary lifestyle, when they are moving, right, if you tell them inhale, exhale, do any movement, so you can check the speed, right, the movement, speed of the movement that time, how they are moving, and the person who is doing yoga from the last 3 months, 5 months or 6 months, the movement speed is differ. So it's not only working on the muscle and the skeletal system, it musculoskeletal coordination of the practitioner also improves. Strength is there, stability is there, right? When the strength and stability you have, movement is going to be more easy for you. So how it improves your dexterity, the skillfulness, improves strength and musculoskeletal coordination of the practitioners. The posture that is assumed, during yoga practices are mainly isometric exercises which provide optimally maintained stretch of the muscles. In the Zumba, in the Pilates, wherever you go, you are saying that movement is there, right? If any movement you are doing, this is movement is happening here. Mostly in the yoga, if we talk about the traditional Hatha yoga, right? So that we say inhale, then exhale, then hold the pose. So your muscle is feeling isometric means the iso is the same, metric is the length of the muscle, right? Iso is same, metric is the in the meters the length of the muscle. When the length of the muscle remains same, that contraction we called isometric contraction. When suppose I am trying to push the wall from here and I am holding this stretch here, I am holding this contraction here. So wall is not going anywhere, my hand distance is not going to be changed, and I am pushing. So this isometric stretches, right? The isometric contraction helps to improve your strength of your muscles too, and that provides optimally maintained stretch to your muscles. So that's why there is no more energy consuming like in other exercises which we do like cardio. So movement is there, right? The continuous movement is there whenever you're doing any cardio practice. So movement is there. Always there is a movement. When you're doing some dynamic movements also, so energy required must. And you're not holding any stretch, right? You're not holding any stretch anywhere. It is just to maintain your cardio speed better and check your sustainable power around your cardiac region. So this is how improves dexterity, improves strength, musculoskeletal coordination of the practitioner also improves, and it provides maintained stretch that we call the isometric exercises. The isometric exercises comes here. So if we come to the next slide, right, we have discussed about this. We have discussed about all this scientific study on yoga, how it demonstrates. Now, if we come to the next slide here, so in the next slide we can see more of the series of asanas. As we know, when you're doing, suppose any practice, forward bending, there is a counter pose too, right? There is a counter pose. In yoga, there is not only the posture which we say only forward bending. Each category of pose is there, right? There is each category of the pose so that we can use maximum muscles of the body in each and every directions. We have forward bending, we have backward bends, right? We have twisting, we have inversions, we have strengthening exercises, we have flexibility exercises. So each category of the pose We have standing postures. So each category of the pose has been designed. So in this yoga practices, the series of asanas involves of the pose followed by counter pose, right? Followed by the counter pose that is involved coordinated action of synergist and antagonistic muscle, coordinated action of synergist. What are the synergist muscle is? These are the muscles that supports, these are the stabilizers, right? When I'm doing any movement, as you guys have know that no muscle work in isolation. No muscle work in isolation. Like if I say bicep is only responsible for the flexion, no. Yes, bicep is the main muscle that contributes to take my elbow into the flexion. But there are some other muscle that we call synergist, right? That we call the synergist muscle, which helps the main muscle to complete the movement. Then antagonistic. The antagonistic muscles are those muscles which are the opposite group of muscles, right? Which are the opposite group of muscle. If suppose right now I am flexing my elbow, so bicep is contracting, so triceps is stretching. So when these kind of movement happens here, when the postures followed by counter posture, it involves coordinated action of synergist and antagonistic muscles. So what it brings then? Which brings steadiness, right? Because I am not only moving my main muscles and not using the opposite muscle when I am doing counter pose. So in the counter pose, suppose I am forward bending right now, so I am using the front part of the body muscle and the back part of the body muscle are stretching. So when I'm doing counter pose to the back bends, balance. So steadiness also improves when I am using the both group of muscles. It improves strength also. So muscular strength and skeletal strength also improves because you are using front part of the body, back part of the body. When I'm going to the side stretches, side part I'm also using. When I'm going for the twisting, I'm using my obliques muscle and the deeper stretch to my spinal area too. That it improves stamina. So when I'm using all the group of muscle, my oxygen, right? The blood circulation is going all over the body. It's not only going to the one group of muscle or the one part of the body. It goes to the every and each part of the body. So more fresh oxygen delivered to the muscles. So that improves the stamina and prevent us from muscle fatigue. Also, it improves flexibility. If nowadays in the activity of daily living, we are mostly using our posture in the frontal plane, right? In the frontal plane, in the anterior part more. So that happens, this part get overstressed, this part get over weak. So one part get overstressed, one part get over weak. So that's why the flexibility is less. When I'm doing this movement for a while and after wake up from my chair, I'm doing this stretch after 15 or 20 minutes, it gives the balance. So then the flexibility also be maintained. It increases your endurance too. Endurance, it increases like not only we are working for the shorter duration of practice. We can work for the longer duration of practice. So slowly when we are practicing like this way, it increases our endurance and the practice time too. Then it increases your anaerobic power. Sometimes the muscle is not able to get the enough strength of your skeletal system or not able to get the enough blood supply or the oxygen supply. But when it is trained, since the longer duration of time, so it also increases our anaerobic power so that we can work or take the use of muscle or take some work from the muscle little bit longer duration of time. Then it improves your better neuromuscular coordination also, right? Also improves the neuromuscular coordination. If I'm using only one group of muscle, if I have to move to the other movement, then there is no neuromuscular coordination for that opposite group of muscles. So it improves your neuromuscular coordination, the movement, the speed of the movement. When I'm asking to go for side flexion, easy. This side, easy. This side, forward, easy. Backward, easy. So impulse travels to the brain quickly and the muscle get into the action and the movement happens with the state of time. It improved your orthostatic tolerance, right? It improves the orthostatic tolerance, that is for your strength plus endurance mostly. So improves your orthostatic tolerance too. So if we come to the next slide, guys. So body weight it itself used to provide load to the muscle and bones. Because in yoga, mostly when you go to the gym, you're using weights, 30, 20 kg, 50 kg, 100 kg. So here we are not using our body weight itself as a resistance, we are taking other weight too, right? Some outside weight to increase the strength to the muscles and providing load to the muscles. So in yoga here, body weight is itself used to provide load to the muscles and the bones. And this load bearing strengthens the bones and prevents age-related weakening also. That mostly if we are not too much active in our daily living, if we are living in, we can talk about some lifestyle which is more not active, sedentary lifestyle. If we talk about the sedentary lifestyle, only sitting job, no exercises, so this degeneration occurs early, right? That degeneration occurs early, or whatever the age-related changes is there, that comes early if we are following that sedentary lifestyle. But here, if we talk about, if we are using yoga, if you are moving in all the directions, practicing pranayama, practicing meditation, so this load bearing strengthen the bones and prevent age-related weakening, helping in prevention of osteoporosis. The osteoporosis, that is the weakening of your bones, right? The thinning of your bones. In that case of osteoporosis, the patient or the client is more prone for the fractures. So the bone can be easily broken. But if you are doing all the movements, you are using your body weight itself as a resistant, it provides load to the muscles and to the bones, so you can easily prevent your age-related weakening. So helping in prevention of osteoporosis. In that condition, we are not using some movements. We have to strengthen the muscles and the bones so the calcium can be easily flow to the bones. Then, a properly selected set of yoga practices. Stretch nearly all joints and joint capsule without danger of injuries and exhaustion. So this is also the good question, right? This is also the good sentence we can say. How you select your yoga practices, right? How we select our yoga practices. If we are teaching a 30-minute class and if we are involving here all the movements, if we are doing with the joint actions force first, if we are doing the joint movement, so it's not I am taking my student directly to the stretching. When I am doing joint movement, gently joint movement, so the pressure from the joints releases, then only you can use your correct muscles. If in the beginning of the class I say, okay, let's go for the stretching postures first. In the morning, the joints are stiff. You came to the 6-hour sitting jobs, almost the joints are stiff. If the person is new to yoga or new to any physical exercises, until the joint has not been released, it is very difficult to stretch the muscles, my dear friends. A properly selected set of yoga practices stretches nearly all joints and the joint capsule. So the joint capsule is tight. Mostly this happens nowadays in the shoulder because we have less movement, overhead movements, right? Less overhead movements. So there are the chances of the injuries to your shoulder joints too. So if we are doing a good selected yoga practices for doing some shoulder rotation, some shoulder side stretches, in the backward bending I'm doing, so I'm using my front part of the shoulder getting stretched. So if we are moving with proper warm-up selected set of yoga practices, it can prevent us from injuries and overexhaustion. Then yogic meditation is one of merit to achieve concentration for mental as well as physical tasks, such as neuromuscular coordination and dexterity, that is your skillfulness. So it's not only physical movements will give you the benefits. When the meditation we are doing, we are still from here, it's easy to coordinate, right? It's easy to create a practice, or we can get some benefits from our physical and mental body too. So this is the merit, right? This is the merit to achieve concentration for mental as well as physical tasks, such as neuromuscular coordination and dexterity, that is your skillfulness. So not only physical posture we have to stress. If you are doing only physical, that gives more mental stress after some time. So we must have to balance. When I have used my physical body, now it's a time to work with my mental body to get the balance from both. And that achieved to the balanced state of yoga. So we come to the next slide now after this. So there is a role of food and lifestyle also. We could not say only physical movement and the lifestyle. And nowadays in this 21st century, my dear friends, food and lifestyle has an important role too. What we are eating, how we are moving, how much we are using our body in the different movements. So proper physical activity helps in enhancing the movements of the body parts, through which body functional ability will be well maintained. Mostly people walk, right? People say, I'm going for the jogging, I'm going for the morning walk, evening walk. So it is just to maintain the muscular strength, it is just to maintain your skeletal strength also. Movement is also needed, because in the walking, when you're jogging, the whole movement is coming, right? The whole movement is coming. You are holding your body and walking. You're standing against the gravity and walking. So the blood circulation is going to the major part of your body. So easily you can maintain your normal strength and the normal flexibility too, if we are adding some gentle stretchings too. If we are doing yoga with combination, it will be beautiful. It will give you the beautiful benefits to your body, mentally and physically too. So nutrition has its important role. Through quality food, necessary minerals such as calcium and iron for health of bones and muscles. So we need a mineral, as we know that the skeletal system has a function that storage of calcium and minerals. And only when we can store, when we have a good enough strength, right? Only when we can store, when we have a good blood circulation is coming there over that particular part, if we are moving properly, if we are using that part properly, and what I am eating. Nowadays, as we are, fast food. The fast food prepares fastly, quickly, but nutrition is less there. The junk food we say, right? So what amount of nutrition I am taking, the quality of nutrition, not the quantity. We are talking about the quality of food, not the quantity of food. So we must have to be focused the quality of food, what I am eating. Am I eating enough amount of minerals, calcium, iron for the health of bones and muscles? So that's why, guys, it's must necessary that the food and lifestyle has also an impact on your musculoskeletal system. So now as we come to the next slide now, so after this food and lifestyle, if we talk about effects of yogic practices now. So basically, simply if I ask you, with the beginners, as the beginner come to your class, what you say, come to the Tadasana. If the person is like this, or in this posture, as we say, come to the Tadasana, automatically the teacher asks, roll your shoulders blade back, lengthen your spine. So one thing that until the time I'm coming into the different pose, before that, when I feel my spinal column is straight. So it also maintains your spinal alignment. Not only this posture, when I am doing forward bending poses, I am practicing backward bending poses, I am practicing twisting poses. So I am removing the stiffness. I am removing the stiffness from your front part of the body, back part of the body, and the side muscles, which we use very lessly. Mostly we use this movement and this movement. Very lessly we use this movement, and very lessly we practice this movement in our activity of daily living if there is no exercise. So we must have to focus, like when I'm doing any yoga practice, I'm doing forward, I'm doing backward bending, I'm doing rotation, I'm doing side flexion. So I'm maintaining all the muscles, I'm stretching and strengthening all the muscles of my spinal column, around my spinal column, that can maintain the spinal alignment. It tone up lateral spine and prevent lateral disc prolapse. This is what we have talked about before, like this is I am using, if I am not using these muscles. So the disc can slips out laterally. So also the posture like your triangle pose, right? Your triangle pose on the both side and other side stretches pose. That tones up your lateral spine and prevent lateral disc prolapse, in general which you call slip disc. So the muscles are properly strengthened, so then there will be no extra pressure on your other tissues, right? Other tissues, so we can prevent it from the prolapse. It increases intradiscal space. When the movement is going there, good blood circulation around that. Stretching is there, so it increases. If I'm using only this, compression, right? Compression on the disc. If I'm using counter postures, if I'm using the muscle in all the directions, so pressure from the other muscles, from the accessory muscles releases, we use the main muscles and it can slowly increases your intradiscal space, so there is no compression on your intradiscal space too. It maintains the discal nutrition too. How it maintains the discal nutrition? When you're moving in all the directions. So after the movement, the blood flows everywhere, right? The blood flows in your whole spinal column and get more nutrition to your spine and to the disc. When this discal nutrition improves, blood is flowing normally in all the part of your spine, so that improves healing process. When the strength is there, when the flexibility is there, stability is there, endurance is there, nutrition is coming with a normal way, with a normal speed, so then it improves your healing process. So it stretches the back muscles and lengthen and strengthen the posterior muscles. So when we are doing your forward bending poses, so it stretches the back and lengthens and strengthens the posterior muscles too. So that creates maximum space for the vertebra. Elongation, right? Elongation. If I'm moving with the bending spine, there is a compression. But when the teacher asks, extend your spine, extend your spine, extend your spine, extend your spine, so it creates space, right? It creates maximum space for the vertebrae. So then prevent decompression also of the vertebra. When we are doing counter movements, poses followed by counter poses, it prevents decompression of the vertebra. So there will be no compression on the vertebra, and then there will be no compression on your disc. If the compression of the vertebra comes, it changes the shape and the size of the vertebra too. Slowly it will get degeneration, and in the degeneration it slips sometime, that we call spondylolisthesis. Spondylolisthesis. So this spondylolisthesis will be corrected, will be cured, like if we are practicing yoga properly, so it prevents your decompression of the vertebra. And when we are doing, there is no pressure on the vertebra and the disc, it will not lead to any pressure on your nerves because your vertebra is aligned, that maintains spine alignment. So when the vertebra is aligned properly, there will be no compression on the disc, there will be no compression on the nerves because you're stretching the muscle, you're stretching the nerve properly every day. So you can prevent the last sentence, sciatica. So then there is no compression on your sciatic nerve. By doing regular exercises, regular stretching of your muscles, of your nerves, we can prevent sciatica too. So we come to the next slide now. It gives natural traction to the spine, right? When you are doing, suppose, this shoulder stand, when we are going for the inversions, right? When we're going for the inversions or after forward bending, we are doing backward bending. So it gives natural traction to the spine, the mechanical force which increases the space between your disc. If there is any compression, it decompresses your spine easily and gives the natural traction to the spine and increases the space between your vertebrae. So there will be no pressure on your disc. As we say, stretches the hamstring muscle when we are going. Mostly this is the tightest muscle nowadays due to sitting jobs, as we are civilized to the chair jobs more. So these muscles get more tight, that leads the stiffness to your back muscles too, my dear friends. So in the forward bending postures, when we are doing, right, when we are doing some standing balancing poses, so it stretches your hamstring muscles too. So there will be no tightness on the back part of your leg and releases the pressure from your back muscles, from the lower back mostly. It loosens the spinal muscles too if there is a tightness, if you are doing the poses. So it loosens the spinal muscles, so increases the flexibility of the spinal muscles. Prevents fusion of vertebra, that we call degeneration of the vertebrae. Right? It prevents fusion of vertebra. How does this fusion of the vertebra gets into the body? When there is a movement, one movement which we are doing repetitively, or we are overusing a spine in the one direction only. So there is a muscle wasting started. Then the muscle take the load to the other structures. Then other structures take the load to the structures, your hard structure, that is your bones, to the vertebrae, to the disc, to the nerves. But if you are doing proper movement, blood circulation is there, nutrition is there, we can easily prevent fusion of vertebra. Removes, what it removes? Sluggish and stagnant blood from the spine. The sluggish blood, which is the bad blood supply, and stagnant blood from the spine also. And the fresh blood comes, fresh nutrition comes to the spine, and your spine becomes more happy and healthy. And also prevents thickening of the connective tissue. If there is extra stress on your spine, when the extra stress comes to the vertebrae, so the other connective tissue gets more thickened, like your disc prolapse, disc herniation, your ligaments get more weaker. So that how also we can prevent the thickening of the connective tissue with the posture training. So if we come to the next slide now. So standing asanas, when you're talking about the standing asanas, in the standing asanas there is not too much movement which we have to do. So in the standing asanas, consider disease of the skeletal system like arthritis, slip disc, etc. The mechanical realignment in the knee by rejuvenating the cartilage. Mechanical realignment in the knee by rejuvenating the cartilage, pulling the tibia and fibula away from the femur and relieves arthritis, my dear friends. Mostly any posture we are doing, nowadays we are sitting like this way, pressure. If you are doing any standing pose, when we are doing any standing, if I am moving from here to the standing pose, so what is happening? There is a mechanical realignment that comes. If I am standing properly, it releases the pressure from your tibia and fibula and create the space, so that can prevent you from the arthritis. Arthritis, that is your inflammation inside your joint. Cartilage destruction is there. So this standing postures, if we are practicing every day, so we can prevent ourselves by the arthritis too. For a slip disc, the bony column and muscles are pulled apart so that the disc is not pressurized. Is it? Yes, this one is true. That is for a slip disc. When we are doing the posture like standing posture, mostly by using the body in one direction more, muscles get weakened, it brings the load to your other connective tissues, and then the slip of disc. So for a slip disc, the bony column and muscles are pulled apart so that the disc is not pressurized. When there is no pressure on the disc, alignment will be in neutral position. All standing postures are meant to strengthen the ankle, knee joint, the hip joint, the arch of the foot, the spinal joints, etc. Yes, that when we are standing properly in the Tadasana also, if I am able to stand properly, I know that my muscles of the hips are using, knee joint, ankle, and the arch of the foot is getting strengthened also. So it is strength, your muscles of your ankle joint, hip joint, knee joint, and arches of the foot too. So decompressing of the intervertebral joint takes place, allowing relief for a prolapsed disc. When there is no compression, the posture which we are using, like forward bending slightly, is more not we allowed when there is any slip disc. So going for the forward bending not allowed, because then the disc can slip more from their original space. So when you're doing the backward extension exercises, slight twisting is there, slight side extension is there. In that combination, so there is a decompression of the intervertebral joint, the joints between your vertebrae, and takes place, allowing relief for a prolapsed disc. So it releases the pressure from your prolapsed disc, and the chances that the disc goes back to their natural space, to their neutral space. So if we come to the next slide, my dear friends, in the standing asanas, because of the stretch of these paraspinal muscle and the intervertebral ligaments, any fusion or arthritic changes in the spinal joints can be arrested. The one thing we can say that some of the joints in our body where the ligament is not that much flexible, if we are going to talk about the knee joint, as it's trying to stretch, if it is getting too much sometime, ligament tear is there. But the spinal has good level of flexibility in their ligaments. They allow little bit flexibility is there with the support tool. So when we are doing standing postures, so paraspinal muscles and the intervertebral ligaments, any fusion or arthritic changes in the spinal joint can be arrested easily if we are practicing of the stretch of paraspinal muscles. Standing poses cause a natural traction, as we have discussed in the previous slides also. When we are going for the standing postures, there is a complete traction. It's not to bring your shoulders up, it is just to be lengthening of your spine, just lengthening without lengthening of your shoulders up. So just spine has to be neutral, pelvic has to be neutral, and release the pressure from your whole spinal column. So it gives a natural traction to the spinal column, restoring the intrinsic strength of the muscle. Whatever the intrinsic, the inner power of the muscles can be maintained here, and so that a future disc prolapse is avoided. So because of that, because the back muscles are very big muscles, guys, as long as time it will take to get weaker, more double time it will get to take it into strength back. So we must have to bring this attention to get this natural traction to the spine, maintain the intrinsic strength of the muscle so that a future disc prolapse is avoided. So this is in direct contradistinction to medical traction, which only is an external force. When you're taking the medical traction over there, laying down on the bed, you have this one belt here, one belt here. So that is the external force that is creating the pressure on your vertebrae. So once the external force is removed, the problem surfaces. So unless the muscle retain its resilience, which keeps the intervertebral spaces apart, preventing compression of the disc, the problem will reoccur. So as you have got that traction, after that you came back to your normal activities, again we are repeating this. So this is for the short duration of time that we can release the problem. If we are not working on this intrinsic strength, the intrinsic strength of the muscle, the problem will reoccur again and the disc prolapse comes again. So all musculoskeletal problems which are mechanical have to be dealt with mechanically, right? So whatever the mechanical force is there, all the musculoskeletal system which we got, it can be dealt with mechanically only. We cannot do any other problems over there, like if there is a fracture, there is a dislocation, it cannot be cured. We can prevent after the surgeries, after the rehabilitation, we can do some maintaining strength exercises so the problem will not reoccur, or we can prevent. So that we all call prevention is better than the cure. So all musculoskeletal problems, guys, which are mechanical have to be dealt with mechanically. We could not say that any implant is inside your body or any fracture or any dislocation we can correct it by yoga. That is whatever the cause, if it's mechanically, so it can be dealt with mechanically. So yoga only we can use as a preventive exercises after the correction, after the relocation, and we can use as a rehabilitation. So these are some benefits which we have discussed about the standing postures. Now if we move to the next slide now, forward bending asanas, right, has a beautiful effect on your body that we use our body in anterior plane mostly. So our stretching towards the back part of the body is very difficult. So if we are practicing it regularly, maximum elasticity of the spine is provided for in these poses. Maximum elasticity. Whenever we are learning about the forward bend poses, we can see the stretching of your spinal extensors, stretching of your hamstrings, and the stretching of your calf muscles. The pelvic joints are made supple as are the sacroiliac joint. So pelvic joints are made supple as are the sacroiliac joint. So this, we don't have to be confused here. You don't have to be overstretched too much, right? You don't have to be overstretched. There's two joints around your back that we call the SI joint. So these pelvic joints are made supple as are the sacroiliac joint. So we can take little bit movement from there, and whatever the tightness in the ligaments around that area in the sacroiliac joint can be released easily. So the spine has to be moved right from the sacroiliac muscles and not from the lumbar, which is harmful. Now we can see, if we are moving from the lumbar spine, this is happening, right? This happens if we are moving like this. Mostly in the beginners, what happens? This is inhale, bend forward, all the stress comes here. If we are using an anterior tilt properly, stretching the muscles from the sacroiliac area, it's easy to get into the forward bending, and that's how we can prevent injuries. So whatever the spinal length one has in a standing has to be retained in all forward bends done standing or sitting. This is the key to a correct stretch of the spine. It's not in the standing you are changing your length, in the sitting you are changing your length. Whatever the range of motion, if I'm able to hold it here, that's it. Try to maintain your spinal length, right? It's not you are changing and trying to get doing this. This is wrong and create more injuries on your lower back plus sacroiliac joint. So whatever the spinal length we have in a standing, retained in all forward bends, done standing or sitting. This is the key to a correct stretch of the spine, my dear friends. So these are the effect of forward bending asanas. If we come to the next slide now, so next it comes to the backward bending poses. So the arms are fully elasticized and frozen shoulders can never occur. During the backward bending poses, if we are doing, we can easily do this. So the spinal mobility also maintained, strength of spine has been maintained, and you can do and correct the elasticity of your arms. You can easily open if you are doing with this. You can easily open the shoulders. If you are going for more deeper, you can easily bring your shoulders back. So the elasticity of your arm muscles can be maintained. So there is a good range of motion in the flexion, in the extension, mostly in the flexion we can gain more, and so the other muscles also can be stretched properly and we can prevent frozen shoulder, the periarthritis shoulder also. Urdhava Dhanurasana, which prevents spinal compression. The upward facing bow, right? The bow pose, the Urdhava Dhanurasana, which prevents spinal compression. So when you're trying to extend the spine properly in the Urdhava Dhanurasana, in the bow pose, like this way when we are moving, so it prevents your spinal compression and releases all the compression from your spinal area. So these poses retain the inner vitality of our framework, which is nothing but the musculoskeletal system. So these poses, the backward bending, it retains, it balances, it maintains the inner vitality of our framework, which is nothing but the musculoskeletal system. If you are not doing the backward bending, only focusing on the forward folds, maybe the problem with the musculoskeletal system, my dear friends. So we go to the next slide now. The inverted poses, the inverted asana. So the bones of the neck are strengthened, as are the cervical muscle. Mostly nowadays, because of tech neck, we are using the neck muscles like this way. So these muscles get imbalanced. These muscles get over-weakened. The posterior muscles of your neck get over-weakened. We are not using these muscles. No awareness on the shoulders. So if we are practicing the inverted asanas with the range of mobility, with the range out of pain, out of discomfort, and slowly we are progressing to the inverted poses. So the bones of the neck are strengthened, as are the cervical muscle, and the neck can be realigned in the neutral shape. So in fact, the weight in handstand does not fall on the neck at all, but on the trapezius and biceps and the forearms. So inverted asanas, the weight in handstand, when you're doing the headstand, the Sirsasana does not fall on the neck. If the neck muscles are already weakened, it's easily to get into the neck. If we are correct using and distributing the weight on the traps, on the trapezius, using the biceps properly when you are grabbing like this way, and the forearms. So we have to engage these muscles. It's not you are loosen up your forearm and creating whole stress on the neck, maybe the chances of the injuries on your neck area. So use your traps properly, use your core, use your bicep muscle, and forearm has to be engaged properly. The cervical and lumbar spondylitis are prevented if you are doing inverted poses. A good blood flow around your spinal column, right? A good maintained mobility, a good blood circulation on your cervical and the lumbar spine too, and the spine get realigned easily. So the spinal column can get good nutrition around all these areas, and the lumbar and cervical spondylitis, the degenerative changes, or when the vertebrae goes to the out of alignment, that we can prevent easily. So if we come to the next one, guys, after inverted asanas, the twisting. As we say, the twisting helps in gaining the realignment. So it helps in gaining the realignment, because if we are using forward bending, backward bending, not doing the twisting, these obliques, right, the abdominals, the oblique muscle are there, these are not getting balanced. So maybe the overwork has to be done by your anterior part of the body or the back part of the body muscles. So that's why we say twisting posture, it helps in gaining the realignment. Alternative, contraction and relaxation. When we are doing the twisting, one side contraction, one side relaxation. One side contraction, one side relaxation. So what we say, alternative, contraction, relaxation, that improves the strength, flexibility and skills of the muscles. So sometime when your one group of muscle is weak, so suppose the other group of muscle has to work, so it can compensate for you at that time and can prevent injuries also. So twisting posture has its own effect on your musculoskeletal system, and if you have a sitting job or standing job, guys, and working on one plane for a longer duration of time, so don't forget, take 5 minutes to do twisting poses. If it is possible to practice in between your work job after 1 hour, will be more beneficial for you, my friends. So these are the twisting asanas. Now if we come to the next one. Now, how pranayama helps? People say it's only with the breathing. So breath has a muscles, because how we are breathing, because muscles are working. Yes, we know the diaphragm is the main muscle for the respiration. Some accessory muscles which we have, and their own physiology is there in the pranayama. So pranayama improves oxygen and nutrients to the muscles. That's why we say we have to breathe properly, right? The breath has not to be faster. The pattern of breathing is not from the chest. So less amount of oxygen travels to the lungs. When the less amount of the oxygen travels to the lungs, my dear friend, what happens? It will deliver very slowly, and the oxygen is not properly absorbed in your bloodstream. So your blood will carry less nutrients. But when we are doing the pranayama, improving our lung capacity, improving the pattern of breathing, so that it improves oxygen and other nutrients to the muscles, and then the muscle will not be fatigued. There will be less DOMS, that is a delayed onset muscle soreness. So this pranayama also pump the lymphatic fluid and remove toxins from the site of inflammation. Inflammation doesn't mean when you have a fever, when you're feeling hot. Sometimes we have an inflammation which we doesn't know sometimes. So it's sometimes tightness, over tightness also lead to inflammation. Sometimes over weakness also leads to the inflammation. So if the pranayama has a one more effect, that it pumps our lymphatic fluid, right? The pumps our lymphatic fluid, so it removes the toxin and from the site of inflammation, and lymphatic drainage has to be normally maintained. It reduces fluoride levels in the blood also, right? It increases the oxygen level and reduces the fluoride level in the blood, and maintains the CSF in the spine, the cerebral spinal fluid which we needed in the spine. So it maintains the normal amount of this cerebral spinal fluid in your spinal column, which reduces the inflammation, and the impulses can carry easily from body to brain and back from brain to body. So that's how the pranayama helps to the musculoskeletal system. So after the pranayama, if we come to the next slide, meditation. Meditation has its own effect also, my dear friends. Effective relaxation of muscle and joints will be achieved. Because if I am focusing on the physical body only, as we all know that 70% of the people are carrying mental pain because they are not doing too much heavy jobs, heavy work, right? Sitting easily, but mentally they are too much pressure. After doing physical activity too much, if I am focusing on here, so all the attention goes away from the physical body, working on my mental steadiness, my mental stability, my concentration, my focus. So that helps to bring more awareness towards my brain, towards my mind, how it has to be get into the stable state. So then only we can feel the effective relaxation of muscles, and the joint will be achieved by the static meditation techniques. Sometimes dynamic also, you feel whatever you hold, you release, after that you feel more mobility. So it's not about to hold, it's about to release whatever we don't need in our life. Energy release from physical tension. So energy release from physical tension, because then it comes to the mental concentration and focus, vitality. So it brings the vitality in your body. So vital force can be increased easily, vital stability can be increased easily in your musculoskeletal system. So energy released from mental repressions, vitality also. So whatever the mental repressions are there, the energy released from that and more blood flow gets over there and you feel more light and relaxed. And it also helps in the pain management. When you get your awareness away from the body towards the brain, when you work on our center part of the body, the powerhouse that is your brain, healing starts easily and then help you for the pain management. So I hope guys this must be clear to you, all the benefits, the effects of yogic practices on musculoskeletal system according to the asana category, overall journal benefits in relation to pranayama and meditation too. So till then, enjoy your day. Have a nice day. Namaste.